Top of the day, everybody. Good morning. Please have a seat.
Day and good morning, everyone. Welcome to the Office of the Governor, bright and early on this beautiful Monday morning. We're here to proclaim October 6th to October 12th, 2024 as Primary Care Services Week. Before I begin with the program, of course, I want to recognize the presence of the Honorable Joshua F. Tenorio, our Acting Governor of Guam. Also joining us this morning, I know she's wearing a different hat, but we're going to recognize her as the Mayor of Dededo, Melissa Savarez. From the Department of Public Health and Social Services, Peter John Camacho, our Acting Director, as well as his Deputy Terry Ugan, Chief of Public Health, and Catherine McCow, Chief Public Health Officer for Public Health. I also especially want to acknowledge our public health community health centers, our staff here. Hafide, please give them a round of applause. Our STD programs here. Also, one STA clinic. Hafide, welcome to the office. AMC clinic is also here. And I also want to acknowledge those watching on our YouTube live stream. That's youtube.com/GovLuGuam. Without further ado, I want to give the floor now to Catherine Nkau, Chief Public Health Officer for Public Health, for her remarks.
Good morning, Honorable Acting Governor Josh Tenorio, our Acting Director Peter John Camacho, Deputy Director Terry Agun, our Chair of CHC Board of Directors, Mayor Savarez, and the rest of the CHC Board members present here, our partners in the primary healthcare field in the community, SDA, AMC, and our program managers and the rest of our CHC staff. Good morning. Thank you to be here. So this marks the day of the annual National Primary Care Week. Comprehensive role of the Department of Public Health and Social Services in the primary care plays a crucial role in delivering primary care services across Guam, ensuring that residents have access to essential health care through multiple programs and initiatives. Recognizing the community health centers are the cornerstone of this effort, providing high-quality, affordable health care to thousands of residents, especially those in the underserved and rural areas. And essential healthcare services, the Guam Community Health Centers provide a wide range of primary care services, including routine checkups, preventive care, chronic disease management, pediatric care, and maternal health services. That includes our partners in the community as well, the private clinics, that we can serve all the people of Guam. As part of the nation's largest primary care network, the community health centers across the U.S. serve over 30 million people annually, ensuring that everyone, regardless of income or insurance status, has access to comprehensive, high-quality care. So, without further ado, I leave it to you.
Thank you, Ms.
Thank you
Catherine.
so much.
Thank you so much, Ms. Catherine. Before I proceed, I do want to acknowledge the presence of Manila Mayor, the Honorable Alan Angata. Thank you so much for joining us. And I do want to turn now to protocol. We do have a brief video to show to our viewers.
Primary health care meets the majority of people's health needs during their life. It welcomes a child into this world, providing services like vaccines that protect us and our communities against infectious diseases. Primary health care supports us through childhood, adolescence, and adulthood, with services to keep us healthy, like guidance on good nutrition and physical activity habits. It keeps a close eye on risk factors, runs diagnostic tests, and can confirm a number of diagnoses right in your local community, be it at a rural midwife post, family doctor practice, city clinic with a group of doctors, a social worker in a community centre, or a pharmacist on the corner of your street. Primary health care also treats and manages a number of conditions through regular follow-up care, prescription medications, and further prevention, including chronic conditions such as hypertension, diabetes, and asthma, in addition to mental health and urgent care needs. Primary health care provides services for people of all ages to take charge of their health and confidently manage their needs, in partnership with their regular health providers, family members, and caregivers. It meets the majority of our health needs during our life, and even accompanies us into old age, adding life to years and years to lives. Primary health care needs our support, just as it supports us.
Thank you so much. Just in time for his remarks too, not to frazzle him at all. I want to recognize Dr. Robert Leon Guerrero, Chief Medical Health Officer from the Department of Public Health. I want to give him the floor now for his remarks.
So you can't be a doctor without being late. So I have to practice what I preach. So I apologize for keeping you guys waiting. But that was a nice short video of what primary care is all about. And we're here to recognize the importance of primary care. It's the backbone of medical care. It provides for prevention in children, immunizations, in adults, leading a good lifestyle so that less problems with diabetes, high blood pressure, and heart disease. And when the problems do start occurring, providing treatment in a timely manner so we don't send them to the hospital. And also knowing when to refer to specialists. In the beginning, primary care on Guam was not very good. Okay, you had GMH, and the hospital is never good for primary care. The only other place was the military, and not everybody had access to that. Clinics were just mainly public health, which was attached at that time to GMH, and you also had CMC. And for those people that don't know what CMC, that was the forebearer of FHP. They were the Catholic Medical Center. Those were the only primary care areas. And like I mentioned, a hospital is never good for primary care. In the 70s, 80s, and 90s, there were more primary care clinics growing. Besides FHP, you had SDA, but it was a missionary clinic. You had some returning local physicians opening clinics like Family Medical Clinic, but there's still a paucity of primary care. And people could not afford to go to them sometimes, and those that could afford, they had no way of getting transportation. So they ended up at the hospital again for primary care. And that brought up that moniker. GMH stood for Get Me to Hawaii. And that's unfortunate because people at GMH did a wonderful job, but they were doing a job after the problem had occurred and was long lasting. In the 90s and the 2000s, we started seeing more primary care clinics, and that was probably related to the change in litigation to arbitration that Guam was looking at. And so more people were able to come to Guam without fear of losing their hard-earned money because of mistakes or unpreventable outcomes. Primary care in the beginning was mainly Tumuni. Then it started going to Dedido, continued in Agana, Minilao, and now extends down to Inalahan in the Southern Regional Community Health Center. We need more though. We need more primary care because we have a problem of access. IRT, the last 2 years showed where primary care could help out even more. For those that don't know what IRT, that was where the military, the National Guard, had clinics initially.
In the reserve, Army Reserve.
An Army Reserve, thank you. They had it at UOG and then at GCC. But what it shows is that we still have need for primary care for those individuals who may have transportation problems, because at those IRTs, everything was in one location. So hopefully, and this is my plug for Minilao Clinic, hopefully that we return back to public health, because then we can have dental, medical, OB, a lot of care provided under one roof. And people can go there and, they expect to be there for at least 4 or 5 hours because they're going to different clinics. So primary care, again, backbone of medical care. We do need more. And we need to encourage people that are local to return and those that are not local to check out Guam because it's a good place to live. Thank you.
I now want to give the floor to our acting governor, the Honorable Josh Tenorio.
Good morning, everybody. So for me, right, my primary, when I was growing up, my mom was a teacher, my dad worked at GTA, and my earliest memory of going to the doctor was actually at SDA. Like what Dr. Bob is saying, I think the initial part or the transition of healthcare into expansion of primary care was the expansion of the middle class. And it really was government of Guam and the federal government providing good paying jobs and health insurance to their employees are the cornerstone of trying to expand primary care clinics and the patient base. And of course now with retirees on Medicare and Medicaid and the expansion of Medicaid, the establishment of the community health centers, which is a turning point in our history. I think that combined with Dr. Bob's vision of the return of the Central Public Health Clinic, which was not a community health center, those are all different things, including expanding the number of physicians, because we have an expanding economy and private sector is now providing health insurance in many professions. So one of the big indicators that we need some help is just like what he said, that IRT. And I forget the number, but I think there was, and my memory serves me right, is it more than 11 or 1,300 people actually got eyeglasses? And based on the number of people that actually went to the clinic versus what we think the need is, it shows that we have a lot of work ahead of us. And I just want to first say, I want to recognize the tremendous work that's being done already and the expansion and the improvements rapidly that are planned for the community health centers, continuing along with their path to more autonomy and more resources. That's one track, but also expanding Medicaid, the effectiveness of Medicaid registration and the approval process for people who need that kind of health coverage is a big agenda item for us. And I'm very confident that public health is going to be making great strides in the next few months to make sure that we can continue to improve those services and expand the number of people that we can serve. The other thing is non-communicable diseases is very high here. So we already know that we have high diabetes, renal failure. These are all things that we've been afflicted with in this community for decades. And unfortunately, one of the rapidly expanding businesses is dialysis, right? This is happening in many underserved communities. And on top of that, we have language barriers. We have migrants or children of migrants that were not familiar with having primary care services, healthcare services in their islands of origin. And there's a lot of health education by social workers and others to try and convince them to get into medical care. And it's so important for the screening. When we're talking about when I was listening to Dr. Bob, you get an eye exam. If you're an adult, that might be an indicator that you might have some other stuff going on. Getting your blood work, looking at what elevated levels that you may have gives you a sign to help modify your lifestyle, or to track high incidences of hypertension and high cholesterol that many people either have an environmental or a genetic disposition to, right? There's so many elements. So I think this morning I would like to encourage the work that all of you are doing. I'm very grateful for the commitment you have. I also want to thank the private sector partners for continuing the work they do out in the community. We can't do it all alone. And even with the private sector and the community health centers, we know we have a large patient base that still is in need of services. So let today be an opportunity for us to bring attention to this cause, but also to recharge our efforts, refocus them, and really for the employees and the healthcare providers that are on the front line of this, I just want to say thank you very much for your work, your dedication, your commitment to our people, because in the end, it's really out of a love and loyalty to the people of Guam that we're all doing this. Thank you very much, and Situs Masi.
Thank you so much to our acting governor. Now for the reading of the proclamation by Deputy Mayor, but also CHC Board Chair, Melissa Savares.
Thank you, Crystal. This is proclamation number 2024-93, a proclamation of the governor proclaiming October 6th to October 12th, 2024 as Primary Care Services Week. Whereas primary care focuses on providing patients with a consistent point of access to essential health services, including preventive care, management of chronic disease conditions, and early intervention for medical concerns, serving as a foundation of overall health and well-being. Whereas Guam's primary health providers have been pivotal in delivering preventive and primary care services to the people on island and have contributed to the improvement of public health outcomes across Guam. Whereas Guam's primary care services expanded in recent years to address the full spectrum of the island's needs, including pediatrics, maternal health, mental health, oral health, preventive care, and financial aid to ensure our people have access to medical services. And whereas the history of primary care on Guam reflects as a commitment to healthcare accessibility and equity, which is highlighted through the services provided by the Department of Public Health and Social Services, community health centers, and through growing partnerships with local healthcare organizations, private practices, and nonprofit organizations to ensure Guam residents, particularly those who are underserved, receive necessary care.
Now, therefore, I, Joshua F. Tenorio, Octu Maggot Lahing Guahan, acting governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim the week of October 6, 2024 to October 12, 2024 as Primary Care Services Week, given under my hand and the Great Seal of Guam to be affixed in the capital city of Hagatnya on the 7th day of October in the year of our Lord, on Domini 2024, and Viva Guam Primary Care Services Week.
Ms. Masi, Mayor Savaras, and to our acting governor. I want to invite everyone now to the front for a group photo, and then I'll wish you a great week ahead.